To determine the puncture site, the suprasternal notch and the lateral end of the acromion are palpated. This is close to the acromioclavicular joint, which is a little more medial. The coracoid is much more medial to this and easy to palpate in most patients. The distance between the suprasternal notch and the ventral apophysis of the acromion is measured and halved. An intradermal wheel is raised. The puncture must be made beneath the clavicle in a strictly vertical direction. The catheter technique is performed using a 55 mm stimulation needle with a Teflon introducer. The stimulation current is set to 1 milliampere with a pulse duration of 0.1 milliseconds. An isolated muscular response on the upper or lower arm is not sufficient by itself, and the block will not be successful. The desired motor response is the rhythmic contractions of the finger muscles, shown here. The stimulation current is reduced in steps to 0.3 milliampere. If the contractions remain visible, 40 milliliters of 1% prilocaine and 10 milliliters of 0.5% ropivacaine are injected with repeated aspiration tests. The development of a complete blockade occurs in 5 to 15 minutes. The catheter is advanced 3 to 4 centimeters beyond the end of the introducer. The catheter is fixed with bandage strips and then wrapped with a sterile dressing.